Hello, how are ya? I'm Dr. Faith, I'm your Faithful Doc, and I thought we'd do something a little bit different today. I was really interested in the Google search history that comes up when you see naturopathic doctors. I laugh because it's bad. It's misinformative, there's a lot of slamming nature going on, which it just surprises me because there's not enough doctors in this world already. Why are we trying to turn people away? Medical school is hard. Do you want to go to medical school? After I did, I don't want to do it again. I thought I would go through Google's most searched history for naturopathic doctors and let you guys know my opinion on these questions. So let's go through them, shall we? The first number one question is, what does naturopathic doctors do? Great question. I made a video, I'll put a tag right here, about what it is that we are and what makes us different from basically every other physician. In a nutshell, naturopathic doctors are into preventative medicine. We try to find the root cause of the issue, and then we try to treat based on what we think is the most common problem and work our way from there. Now, do we do other specialties? Yes, we do. We kind of focus on all of the same things, which is preventative medicine and trying to treat the actual root of the problem rather than trying to just treat the symptoms and giving you some kind of band-aid. Question number 2, are naturopathic doctors real doctors? Yeah, they are. I got myself one of these. It's so big it doesn't even fit in the frame. I also got myself one of these, and also I did a little bit of this. Naturopathic doctors graduate with a doctor in naturopathic medicine, duh, and then they take boards and they take licensing exams. Every state is different. Every state has a different scope of practice, what you can and cannot give to your patients or how you can treat your patients, but we're working on it. We've got legislation all over the place. It's getting bigger. Yes, we're real doctors. We have licenses. We went to medical school. Another common question is naturopathic medicine covered by Medi-Cal or Medicaid or insurance in general? That's a tricky question. Can we just all agree that insurance is kind of a scam? Due to the fact that we're not regulated in every state as primary care providers, and we have states that we are unlicensed in, doesn't mean we didn't go to medical school, doesn't mean we're not doctors. The reason why some doctors are not covered by medical insurance is because the federal government doesn't want to pay for us to give you care. That's what it kind of boils down to. Honestly, whether you're an MD, a DO, or an ND is kind of irrelevant. You'll be out of network for one doctor, even though they're an MD. You'll be in network for another doctor. You got private insurance, you got public insurance. I mean, it's kind of a mess. Even if you go and see MD doctors and you code for a certain kind of condition that they're seeing you for, that might not even be covered. It's all about codes and federal government and what they want to cover and what they don't want to cover. So in general, insurance is kind of a scam. So are they covered by insurance? Really depends on the state. Really depends on the naturopathic doctor. What we have found and what other MDs and DOs are trying to find is that it's actually more cost effective to just charge you a fee for seeing us outside of insurance. Think about it. You're going to have to pay not only the premium per a month, but then a deductible to even get to that point. And who the hell pays $15,000+ for even a couple? $15,000+ to go through a marketplace in order to just get insurance. That doesn't have anything to do with the actual deductible. Yes? No? Sometimes? That's kind of the answer. Another question they have is, naturopathic doctors expensive? Can be. It really depends. Because if you go and talk to a doctor who has a specialty, i.e., I don't know, an ENT doctor or a surgeon of some specialty, they're gonna be expensive because they spent all that time in medical school, all that time in training. You don't even wanna know what medical school costs. The thing is you're not paying a physician for their time, you're paying for all of the training and all of the expertise that they hold in that area. So are they expensive? They can be, but that's only because a lot of us don't actually accept insurance. There's a lot of questions about where we're licensed. Naturopathic doctors are actually licensed at this point in time in 23 states, some provinces, and we're gaining on it. We got like 12, 18 different legislations going on whether states want to regulate us as full practicing physicians. Even when we do get regulated, they have to go through the entire BS of how much, where, what's your scope. Like I said in this video when I talked about the NDs versus DOs, it took DOs 90 years in order to get fully regulated. It really depends on the state to state. There's a naturopathic physician's website which you can go to and you can Google whether you have a naturopathic doctor near you. So I implore you to go check that out because it's a great resource. There's also some questions on what a naturopathic doctor can prescribe. And again, this is very state based because every state has different licensing. In the state of Arizona, we have the widest scope of practice besides Washington and Oregon, and I can prescribe medications under certain classes. Those I'll list right here for you guys. Basically, we have a more limited scope of practice than an MD or DO when it comes to narcotics, but in the end, naturopathic doctors don't really like to prescribe narcotics anyway. We'd rather do more natural treatments when it comes to pain medications. We can prescribe medications for infections, your general thyroid medications, but it really does depend on state to state. Another common question is, how are naturopathic doctors trained? We go to medical school, just like MDs, just like DOs. We go to accredited medical schools. So there's a whole common issue when it comes to what are the difference between a traditional naturopath and a naturopathic doctor. This I want to make an entire video on.
So don't worry, it's coming.
The basis is that naturopaths, traditional naturopaths, they are people who go to a naturopathic school. They are not doctors. They do not get trained in medicine. They do not get trained in prescription medications, and they don't get half the training that naturopathic doctors do. They have a basic understanding in nutrition and how to treat somebody holistically, and they have their own specialties, but they are not doctors, and it's important for you to understand that. I went to a 4-year medical school.
It was hard.
I took boards.
I passed those boards.
I have a license to practice. Traditional naturopaths do not have licenses to practice. So therefore, you must understand and vet your doctors before you go and see them. That should be true for all physicians. You have so much power in your healthcare these days because there are enough physicians to be able to pick and choose about which one you want to go to, that you get to choose who you see. Unless you do insurance, in which you let the insurance company figure it out. But if you are in a position where you can choose who you see, I implore you to pick somebody who you really love and who actually really cares about your health. Another question I thought that was actually pretty interesting is that some people asked, why do naturopathic doctors believe in naturopathy? I am not the biggest fan of the name naturopathic medicine. I'm not gonna lie. I believe us to be an integrative medical physician. I can't speak to everybody's opinion on this question, but what I can say is my personal opinion. I believe in naturopathy because I believe in fixing problems, not covering them up. So treating things before they begin, not so much after they've gone bonkers. If we try to cover up issues with band-aids, I think we can all agree that it never actually fixes the problem. And that's what doctors are supposed to do. They're supposed to fix the problem. But the big difference between NDs and all the rest is that we not only try to find the problem, but we try to treat it the least invasive way possible and then be able to work our way up to the medications if we possibly need it. I feel like that's kind of the reason that we started being doctors, right? I believe in preventative medicine. Another common question was, are naturopathic doctors safe? That's a really good question because you kind of need to know if your doctor knows what they're doing, right? And we're actually trained to be full-on doctors. So yes, they are very safe. They are trained in emergent situations. Do naturopathic doctors do emergency medicine? Absolutely not. We are not trained to be able to take care of somebody in an emergent situation, but we are trained to recognize, diagnose, and be able to refer you to emergency rooms when you are in trouble. You can trust in the fact that we actually know what we're doing. You guys also asked, is there a demand for naturopathic doctors? There's only 6,000 of us. So yeah, I'd say there is a demand for it. People have changed their perspective on medicine, and they don't really want to go down the path of taking medications for the rest of their life. They don't really want to get shuffled under the rug and being told that they have this chronic disease. Here's your medication. They want to be cared for, listened to, fixed. So naturopathic doctors are really good at that. We just want to listen. We want to help. If you're considering being a naturopathic doctor, I highly recommend it. The last question I'm going to cover is talking about this pseudoscience. It's frustrating. Naturopathic medicine is backed by science. Go check out WebMD, because WebMD has a pretty good description of naturopathic medicine. All of our medicine is backed by science. Research articles. And I do have a caveat to say when it comes to research. Research is expensive, and it's hard to get really good science out of small studies, and that's all that a lot of people can afford. The average research project is freaking expensive. So do they want to do it on vitamin C? No. Do they want to do it on vitamin D, zinc, B12, B6? all these other vitamins? No, they don't want to do that because it's expensive. Rest assured that our medicine is backed by science. We have research articles to prove it. There's such a thing as clinical data too, where you observe a patient and you're able to see the effects of that medication on them, and you can do small clinical studies for that. Is that an overwhelming, I'm going to treat all of my patients with this particular thing because a few people experienced a positive effect? No, but it is some circumstantial evidence. So I hope this video is more enlightening for you to kind of answer some of those questions from Google. There's a lot of misinformation out there. Naturopathic doctors worked really hard to go to medical school to help you. We didn't go to medical school to help us. We went there to be able to treat you guys. So I hope this is really informative for you and that you can understand a little bit more about this type of medicine, because I love it, and I feel like if other people knew about it, they would love it too. Because in my personal opinion, it just makes sense. Treat the problem, not the symptoms. You treat the problem goes away. I don't understand why that's so hard. So that's all I got for you for this video. Thanks for tuning in. If you like this content, make sure that you give me a giant thumbs up. Make sure you subscribe if you haven't already. I really appreciate your time, your attention, and I'll see you guys in the next one. Bye!